Hi, this is Julie Lubinsky. I'm the Associate Director of Digital for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to this month's edition of our live chat with Nurse Linda. And Linda is a leader and provider of rehabilitation nursing for over 40 years, and she also is on our online community where she and also on our blog, she's been blogging a whole heck of a lot, where she talks about and she takes questions from individuals with paralysis, and you also talk a lot about secondary conditions, sepsis, and autonomic dysreflexia. And every month we are so lucky to have her live on these webinars. So now I will turn it over to Linda. Hello, Linda.
Hi, Julie, and thank you. Thank you for everyone for joining us today. See, there's a long list of people here online now. I know that a lot of people will be tuning in to listen later on the recording as well, so welcome to you also. So May is Mental Health Month, and so I thought, well, it's a good time to talk about different mental health issues. Now, first of all, I want to say having a spinal cord injury does not mean that you will have problems with your mental health. But it's a good idea just to know what it is all about, what people are talking about. There's so many misconceptions about mental health. And so in the blogs this month, you'll find a lot of definitions about things and like schizophrenia and manic depression. And unfortunately, in our society today, we are so glib about these things that oftentimes, if we see somebody, like really in a hurry, people will say, oh, they're just being manic today. And it's rather unfortunate because, we shouldn't be labeling people things when we don't know anything about them. That person could just be in a hurry. So you just never know how people, what's going on inside of people or how they're feeling. Some of the major psychiatric syndromes do not go hand in hand with spinal cord injury. Unfortunately, spinal cord injury does not exempt you from developing psychiatric problems, but I try to focus more on the problems that people have if you have a spinal cord injury or if you don't have a spinal cord injury in the mental health arena, because people have ups and downs in life. And it's common for us all. Some people, don't have things that bother us so much, and some people have a lot of things that bother us all the time. Some people who have chronic illness, such as spinal cord injury, have a lot of maybe depression or other kinds of mental health problems, substance abuse, just because they're trying to deal with their chronic illness. And that could be spinal cord injury. Could be diabetes, it could be hypertension, it could be just about any kind of physical problem that, is ongoing and is really not quite curable, but has a lot of ongoing problems with it. So a lot of diseases are curable, some are not curable. Some people have spinal cord injury from disease. And in fact, a lot more people have spinal cord injury from disease than from trauma. And it's unfortunate, but I think a lot of times some people think, well, when they're talking about spinal cord injury, they're always talking about trauma. But being on the other side of the fence, I've been on both sides of the fence as a family member of a person who has spinal cord injury and a person and on the professional side. And so I know that when we're talking about spinal cord injury, we're talking about all spinal cord injury. I think that sometimes people who have spinal cord injury from a disease don't think of themselves as having a spinal cord injury because they identify with that disease. So they might say, oh, I have MS, multiple sclerosis, and they don't really even stop to think about, or, it's not necessary to explain to somebody, and because of my MS, I have spinal cord injury problems. So sometimes people think it's all about the trauma because that's where a lot of the money is spent in research in spinal cord injury, but actually much more money is spent on spinal cord injury from diseases, but it's titled under that disease name. So the people who are working on figuring out the disease of multiple sclerosis are also working out some of the issues and physiological issues that go with spinal cord injury. So they're working on spinal cord injury. People who are dealing with research in spinal cord injury are working on it. People who are working in other neurological diseases are also working on issues with the nervous system. So when we put it all together and we do trade back and forth, we read each other's work, we go to meetings where other scientists are there and they're presenting what kind of discoveries they're making. And so when you're working in the nervous system, all of that research is easily translatable back and forth into other disease types that might result in spinal cord injury. Or even in the trade-offs, there's a lot of research, as everyone knows, in Alzheimer's disease. There's always something in the news about Alzheimer's disease, so there's a lot of funding and attention that goes to that. And so those scientists exchange freely information with people who are studying spinal cord injury and cures and recovery techniques. So all that information gets shared back and forth together. So you know, what one does, it benefits the whole group. So if somebody is studying some research in spinal cord injury, it's going to help people who have MS. It's going to help people who have transverse myelitis. It's going to help people who have Guillain-Barré syndrome. So it plays the whole gamut. So a lot is going on in spinal cord injury as well as in other diseases. But I always like to point out that when we talk about spinal cord injury, we're talking about the whole gamut. So people who have trauma and the much larger population of people who have spinal cord injury from disease. But as far as mental health goes, in some of the big mental health diagnostic codes like the schizophrenia, psychosis, and manic depression, those types of diseases, even though you have a spinal cord injury, does not exempt you from those diseases. You could still possibly get that, or you might have that disease already and also have a spinal cord injury. I always think having a spinal cord injury should be enough and that people should have nothing else. That's enough, but unfortunately life does not work that way. So people are always, you know, people with spinal cord injury can end up with gallbladder disease and need their gallbladder out. It's just the way, you know, it's just the way that healthcare in our bodies work. But talking about the research that we do in spinal cord injury, we also look back at what things have been done. So back in the polio, during the time of the polio epidemic, a lot of those treatments that were used back, you know, years ago in the 20s, 30s, 40s, neurological recovery, mostly at that time was centered in the United States around the polio epidemic. But what people found was there were treatments that were being used that were effective. One of the big things was movement, just providing movement. So people would go to these spas or centers. A big one was in Arkansas. That's where President Roosevelt, he had a spa there. And people would go there. They would spend a day in the pool moving their limbs because it's easier to move your limbs in the buoyancy of the water. If you're working on resistance, if you move your limbs really fast and hard, the water will act as resistance. But if you're just gently moving your arms, the buoyancy of the water kind of helps reduce some of that gravity effect. That's very helpful. So that was one of the things we took from years gone by, and now we've, you know, kind of extrapolated that and put some more modern technology on that. And so we have a lot more movement, activity, recovery treatments that are being used in spinal cord injury. It's kind of interesting to see how things go over time and how things that are once considered old-fashioned now are modernized and become new technological advances. But getting back into the mental health thing, so there are mental challenges that some people have. And then there's also some mental health issues that people have sometimes that they don't realize, but just from dealing with a chronic illness. So things like depression or substance abuse, which can be pretty significant for people who are dealing with these challenges. They go hand in hand, as I said, with chronic illness. And so it's good to be aware of that you might be facing some of these issues, because, it's not like one morning you wake up and you just feel horrible and miserable and you think, well, clearly I'm depressed. It just doesn't happen that way. These kind of issues come on very subtly. Something happens medically or through trauma, and all of a sudden you have a spinal cord injury. Sometimes through medical issues, the spinal cord injury comes on very slowly, and it doesn't just happen just in an instant like it does in trauma. So it's a much different process. But people sometimes, when they're dealing with any kind of chronic condition, over time they just find it wearing, that, they're always having to check, always having to do things a little differently, and they think, I just am really fed up with this. Sometimes with spinal cord injury, we find that people get challenged by a spinal cord injury from any cause, and they become super users of technology and super users of therapy, and they're doing everything. And after a year or maybe 2 years, they say, well, this isn't going quite the way I wanted it to go, and I've been doing everything, and I've been doing everything right, and I'm not seeing what I want to see. And so sometimes they face that challenge of, oh my gosh, maybe this is not going to go the direction in the long run where I want it to go, and kind of the depression creeps in kind of later on. So it doesn't happen overnight. It doesn't happen at the instant you get diagnosed with spinal cord injury. It's one of these insidious things that just kind of happens over time. So when you go to your healthcare professional for your annual checkup, there's a real quick mental health questions that they can ask you as a part of their physical exam. And I would hope that they would be doing that anyway, but generally, somebody comes in and they're acting perky and they appear happy, then sometimes people don't ask the questions. But, a lot of times people put on that false front when they're in the doctor's office or when they're out in a social situation, but it doesn't mean that inside they aren't hurting with depression. So it's a good idea to get yourself tested. It doesn't cost anything extra. There's no needles involved. There's no testing involved. Just some questions that they can ask, and they can help you deal with the depression or the problem that you're having. Now, sometimes medication might be advised. I know some people don't like to take extra medication, but if you can take some medication and improve your quality of life, you need to know the risk and benefits so that you can make that choice and then therefore make that decision. Sometimes medication is not the thing that's needed. Sometimes you might be prescribed other kinds of things. People who provide movement in their life, not only does that help your spinal cord injury by providing that input to those nerves and muscles below the level of your spinal cord injury, we also know through other scientific research that activity helps brighten people's minds. It helps people feel better. Not only do you feel physically better, but it also helps kind of recharge your thinking about things. We know that engaging in social activities, so if you have kind of self-isolated over time because it's too difficult to get out or there's just too many challenges, it might be that you need to find some way to get some social outlet, which might be going someplace, or it might be talking to people over the computer. So there's a lot of different ways that you can engage without even going out of your house. Of course, if you can go out and talk to people, there's even some research that says, for elderly people that live alone, sometimes they self-isolate in their house because, they're quite enjoying it in there, but they're not getting that contact with other people. So they say even if you go to the coffee shop and have a coffee every morning, you might get to know people over time. If you look forward to the cashier and call them by name and they get to know your name, making those social connections helps everyone, even if you don't have a spinal cord injury. So those are all things to think about. But talk to your healthcare provider. Sometimes they might recommend therapy, seeing a counselor or psychologist. it might not even be a person, with that much training. It might be someone who, like your minister at your church, who certainly has education in counseling. But there's all kinds of people that have education in helping other people move along. So there's support groups and as I said, there's church groups, or even just going if you're a vet, and even if you go down to the VFW and just interact with people, or just being around people, that seems to help us all when we go meet with people and talk with people, especially if you get to know them. So those are all even if you just go out for a walk or a roll down your street, and you'll see people, meet neighbors. Anyway, that all helps. So it's not something to worry, to be embarrassed about. Always ask for a mental health checkup because it's very quick, it's very easy, and it can help you. They could even say, gee, you're really doing great, and, that can make you feel pretty good. So those are really important things to do. Now, there's also the issues in mental health, and we see this a lot in chronic disease, so spinal cord injury is one of these areas where we see this, where people kind of start engaging in self-harm behaviors. And self-harming behaviors are things that you do or don't do that have significant consequences to your health. So we'll see a lot of people who, either through depression or maybe just through self-harming behaviors. Now, nobody sits down and says, I think I'll self-harm myself. But it just it creeps into your life, and we'll see it a lot with substance abuse, especially with alcohol, or people mismanaging their medications, or concocting some formulations of different kinds of medications to get an effect that's not intended by those particular medications. So they'll take combinations of medications to get a high, or they'll be taking medications that are maybe not prescribed to them. Maybe they're buying some medications off the street. So all those things are self-harming medications, self-harming behaviors, because what's going to happen in the outcome is that you're going to have more physiological problems from those types of behaviors. Smoking is one. It's an addictive behavior, but it's also a self-harming behavior, because you're breathing in that tar and nicotine and those chemicals from the cigarettes, which is going into your lungs, and so that can cause you harm physically over time. Some people say, well, I'm helping myself because I've given up cigarettes and I've switched over to the e-cigarettes or the vaping. But there again, those chemicals that you're breathing in are going to be harming your lungs. Now, the vaping people will say it's perfectly safe, but when you're taking in unwarranted chemicals into your body, either by swallowing pills that are unnecessary, too much alcohol, smoking cigarettes, or vaping, you're taking substances into your body that your body then has to fight, and it's altering the chemistry of your body. So there's a lot of treatments for cigarette addiction, and so you can ask for those, and usually those are paid for by insurance companies because they so very much want you off the cigarettes, because the consequences of cigarette smoking, which can be lung cancer, emphysema, it can be bladder cancer, which, is something we all need to think about with spinal cord injury. It could be bowel cancer. So people know that cigarette smoking causes lung cancer. That's the number one cause. But, the number two cancer that cigarette smoking causes is bladder cancer. And a lot of people don't realize that their bladder cancer has come from cigarette smoking. There's cancers in all parts of the body that are related to cigarette smoking. So talk to your healthcare professional, and if you've tried it before and you say, well, gee, I've done that, I've tried the gum, I've worn the patches, and it didn't work, well, just think of that as round one, because the next time might be the time that's going to work for you. So some people have really bad addictions to cigarette smoking. They've been doing it for a long time. Their body is craving that chemical. That's why there's addiction medicine is so big in society, because there's so many people that are addicted to all kinds of different things. And it can include, some people are addicted to exercise, if you can believe that. Some people are addicted to food. There's all different kinds of addictions. So if you're overdoing anything, you might want to talk to your physician about helping with that. Another kind of mental health problem that sometimes people don't think, okay, we talked all about now what could be wrong with us, but we could be surrounded by people who maybe we're really depending on. Since having a spinal cord injury, you might have someone coming in to help you, or even someone in your family who's helping you who maybe is not so reliable because maybe they are having some addiction problems or some mental health problems. So be aware of the people who are taking care of you, who you're really relying on turning you and getting things for you like your medicine or going to the store and getting your medicine. They could have an addiction problem as well, so you need to be alert. People and their caregivers get very enmeshed with each other, as they should be, because you've got this person you're really relying on to be there for you. It might be a family member. It might be someone that you're paying to come help take care of you. And again, these things don't usually pop up overnight, but, your caregiver should be taking care of you, and you want to be on the alert should your caregiver start abusing you. And as it wouldn't be a kind of thing that somebody would come in and start, like hitting you or beating you or something. People are like automatically, well, I know that's not right. But what usually happens is this behavior comes on very subtly, and it might be just the kind of thing where you say something and they disagree with it continuously. Or you say, I really need to be turned, and they're like, no, you've got 5 more minutes. Wait 5 more minutes for your turn. Well, when your body needs to be turned. So, if somebody's constantly discounting the things that you say, or if they're not showing up for their shifts, or if they're coming to your place where you're living to take care of you, and the first thing they do is go to sleep, or the first thing they do is come and have something to eat because they arrive hungry. Look for those kinds of little things that might be hints that you might be heading into an abuse situation where somebody could be abusing you. One of the things that I think people need to really be careful about is you should, as I always say, you should know what your care needs are. Don't turn your body's care over to somebody else. Somebody else might be doing the physical act of turning you or catheterizing you, but you need to know when that needs to happen. So think about when you're taking your medication in particular, look at your medication and make sure it's what the pills are supposed to look like. If you're taking medication for pain and kind of suddenly it's not working. Now, sometimes medication for pain, especially neuropathic pain, is kind of difficult because sometimes it's slowly, you're taking the same dose, you're taking the same pill, but it slowly stops working as well as it used to. Okay, that's different than one day you take your pill and it's just not working at all. Now, that could be something else going on in your body. Could be having some kind of, problem, maybe a pressure sore developing, maybe you're having a spasm, maybe you're just getting the flu, and so the pain medicine's not working as well. But if you find that your pain medication's not working suddenly, or you find that it looks different, or you find you're just not getting the correct number of pills, or you don't see that little yellow pill that you always get, have your pharmacist or have somebody that you trust, a family member or even a friend, a close friend, that can come over and look at your pills and make sure they're the correct pills in the bottle. So sometimes your care provider might start diverting medication away from you, or they might be selling your medication to somebody else or giving it to somebody that they know that wants that narcotic or whatever it is you're taking. So just be very careful. Remember that your caretaker, you want to have a good relationship with them, but they're there to provide a service for you. Now, if it's your wife, you're on a different level altogether. But if you're paying somebody to come in to help you, they're there to provide a service, and that's what they should be doing. So sometimes people get in this relationship and they're like, oh, gee, I need to leave a little early again, or, all different kinds of things. People sometimes start taking advantage, and it comes over time. So be sure and stop and think about that. Well, I've gone on, but, just be cautious with yourself and your money, your medications, but mostly with your body to make sure that you're getting the things that you need. So, and as I say, these things just don't come, all of a sudden one day, and it's like a lightning bolt that hits you, but it might be a lightning bolt where you suddenly wake up to a situation that's going on that isn't so good. Some people will want to confront the person right away, but you'll have to think about that. That may be a good thing or a bad thing. You might want to contact, if it's a person who's being paid to come into your home, you might want to talk to their supervisor instead of talking to them, because if somebody arrives at your home to care for you for a shift of time, and you say, I'm not getting the results for my pain medication. Are you feeling it? It might be a bad thing to confront them with. So if you need somebody else to be there with you, by all means, that doesn't make you any less than what you are. It's just that you need to have protection. We all need to have protection at different points in our lives. So if you need to have somebody with you, even if it just make you feel more comfortable, just be sure and do that, because the caregiver could say, I'm not stealing medicine, and get up and walk out, and then you're kind of left without anybody to care for you. So all those things are things to think about, but be sure, you're number one, so be sure and think about life in that regard. Be kind to everyone, be nice to everyone, but you need certain things, and the people are there to provide those to you. They should be providing those services to you. Okay, let's do some questions. So this first question is a good question for us all, and it's, how do I get support if you don't have family support? And this is a loaded question, because I do see people who have families, but they don't support the person who has the spinal cord injury. And by that I mean, there may be a family that just isn't visiting a lot. Maybe they didn't visit a lot before. Maybe they just weren't closely connected. Sometimes families are very closely connected, but somebody has trouble and, hey, where is everybody? They're suddenly gone. And I see this a lot. So it's a good idea to think about how you can get support if you don't have family support. There are a lot of agencies out there who will provide support. Some of them have paid services, and some of them are volunteer type of arrangements. Now, by support, the volunteer ones might be people that would be willing to come over and help. It's hard to find somebody who will volunteer to come every day and do a lot of lifting or a lot of personal care. That usually is provided by people who are paid to come into your home. And there are agencies that will help you with that. So if you're not sure who to contact in your area, there's a bunch of options that you have. You can call your local hospital and ask to talk to the social work department, and they will help you connect with some names of some agencies that provide personal care, or they will also know some agencies that will have people come over and maybe, chat with you for a while, or somebody who might go to the store for you. Most of these things, if you don't have a family support, they are going to cost. You're going to have to pay, but there are agencies that will provide these services on a sliding scale, so you pay the amount that you have available to pay. So what I'm saying is, you might not have to pay the exact cost, but there are agencies that can help you defray some of those costs. Now, there's other organizations that are out there that can help as well. And if you're active in a church, you can talk to the minister at the church and ask if you can be directed to a congregational care person that can connect you with different options. Some churches have options, some churches don't have as many options. I know several churches that provide Meals on Wheels, and you can connect through your doctor or through the church, and those can be at reduced prices as well. Those are very reasonable. Meals on Wheels has had some changes, so it's not as plentiful as it used to be. There's not as many options, but that's people who bring food into your house. One time a day they stop by and bring enough food for lunch and dinner. It's one meal, but it's really more than one meal because there's so much that they bring. So that is helpful on the one way. It also helps you with your socialization because you know these people who will be coming to bring your food. You get to know them, and they'll usually chat for a little bit, which is kind of nice. There are other organizations around town that maybe will be able to help find volunteers to come in and do things for you. So if you want to call different social service agencies, if you have spinal cord injury from a disease, you might be able to call the MS Society, and you can get a lot of equipment, and they have a lot of programs that go on that would be helpful, and they would have also links to people who would be willing to help. Again, that would probably be for a fee, but at least that would get you the support that you need physically. Social support is a little more easy to get without a fee because people are happy to come in and talk, but they don't necessarily want the responsibility of the physical care. So those are kind of things. Another great resource is if you call the Christopher and Dana Reeve Paralysis Foundation and speak with someone in the peer mentor support group, and they can connect you with someone who lives around in your area. They might know someone who lives right in the same city that you do, and they probably have already gone through this, which is why they're peer mentors. And so they would be able to help direct you in your own community. They can direct you to all kinds of services. And so that's really an excellent place to start because they're just really terrific people that are really willing to help you in all different ways. There's also the community, which is on the Christopher and Dana Reeve webpage, and that I really encourage everyone to get involved in because they're people write in topics about all different kinds of things, so that can help you garner ideas. You could even post an idea. Where people found a good source of supplies of catheters, or where's the best place to get a wheelchair cushion. There's just all kinds of things that people post on there. There's different groups, and so you can look at all the groups. You can figure out which group you best fit with. There's just all kinds of things that you can find on that. So sometimes people just don't have family support, so don't think that you're the only one because we see it a lot. And we see it a lot, as I said, from different avenues. Close-knit families that the family just can't deal with the whole spinal cord thing, and they just kind of fall apart at that moment. And then there's also there's just sometimes families just don't want to be involved in lives of other family members for whatever reason. Sometimes it's some historic thing back generations. But just, ferret around and you'll be able to find some stuff. But those are some really good places to start. The foundation or, look at social service organizations in your community. If you do have a church or if you belong to some organization, or you can talk to the people at the Variety Club or the Lions Club. They're good about helping people get equipment. Now, you might call those organizations and talk to somebody, and they might say, oh, no, we don't really do that kind of thing. just wait a couple of weeks and call back and talk to somebody else. You've got to find somebody who's interested in your cause when you get to those kind of organizations, because they do help people, but they help only a few people a year. They do more community-wide funding, but every once in a while you have these service organizations in the community, and they will provide like a van for somebody. Now it's kind of hard to get into that, but if you know somebody who belongs to one of those organizations that can represent you, and then they can pick up your cause for you within their own organization. If you have a pediatric patient, a child with spinal cord injury, don't overlook the Shriners hospitals, because they're absolutely fantastic at what they do. So, but they only do pediatric, so that's just another support place that you might not have thought about. The next one is a person who's very worried of getting another pressure ulcer. Yeah, I agree. So they're restricting their sitting in their chair, and they're changing positions in bed. There's a red spot that's hard to the touch. Any suggestions? Well, if you've had a pressure ulcer, your skin is very susceptible to having a second one, because once you've had the pressure ulcer, that skin has been damaged, and so it forms more like scar tissue, and scar tissue is not elastic like your regular skin is. It doesn't have that give and take. So once you have a pressure ulcer, that skin is very tender there, and can easily break down the second time, actually even more readily than the first time. So sometimes people have a pressure area in one spot, and they just worry about getting a pressure area on a second spot, because having a pressure area is always kind of a little bit difficult. They're changing their positions, which is really great, but there's this hard spot, this red spot that's hard to the touch. So that means that actually is a stage 1 pressure ulcer. So there is a pressure ulcer there. Now, when you see a red spot on the skin, that's your first clue that a pressure ulcer is forming. But it's not really is forming. It already has formed inside the tissue. This is the unfortunate thing about pressure injury, is that when you see the red spot, there's already damage to the tissue on the inside. And that's why that spot is red, is because it's not getting the circulation that it needs. So it's kind of like a red bruise, if you will, because there's not circulation going through that area. So the only way to heal a pressure area, and this is the thing that people just don't want to hear, and I don't like to say it, but it is the only way to heal a pressure area, and that is to stay off of that area. Sometimes you have to stay off of it for several weeks or even several months. But if you have surgery to that area, if it takes a surgery to heal that pressure area, then you might have to stay off that area for 6, 8, 9 months or even longer. So some people say, oh no, I just can't stay home and stay off this pressure area for 2 weeks. Well, if you sit on it, or if you apply the pressure, if you lay on it, if you apply the pressure to the area, you're just re-injuring the area. So even if you stay off the pressure area for a couple of days and the red spot's still there, and you just get up to go brush your teeth, you've just blown the whole days that you've been off there, because now the pressure's back on there, and it doesn't take long for pressure to be started inside your body. It takes a long time to heal the pressure, but it does not take but seconds for that pressure to start causing damage. So the big thing is to stay off that pressure area. Now, there's a next question is about what medication to use on skin breakdown on the buttocks. Well, if the skin is just a red spot, you don't want to put anything on it. You want to keep it clean. You want to keep it dry, but you don't want to put any medication on it because the skin is still closed. So there's no need to put medication on it. Now, there was a bunch of old theories. These are old theories. We don't use them anymore. That you would put different lotions, or you would rub, or there was even a theory about putting alcohol in there. The only thing that's doing when you massage a pressure area or rub anything onto it, the only thing that does is add more pressure from the rubbing and the massage. So that's the last thing you want to do. If you have a pressure area, you keep the area clean and dry, and you stay off of it. Absolutely. So if the area becomes open, then you might want to put some medication on it. Something as simple as if it's just open a little bit, you could put some Neosporin on there with a Q-tip. You never take the Neosporin and put it on with your finger. You never take the Neosporin and put it on, just with the tube and kind of goo it on there. You don't ever want the tube to touch the skin or the sore. So put the Neosporin from the tube on like a little Q-tip, and then just gently rub it on the open area. Be sure and check with your healthcare provider if you should be doing that, or if you should be doing something else. But when those wounds are open just a little bit, usually that's what people do to keep infection out of it. But remember, it's kind of like an iceberg. When you see this red spot on the outside of the skin, you think, oh, well, that's just about an inch, and I see where that is and what's going on. But underneath, the wound in the tissue is much more significant, and you can't see it because it's covered up by your skin. Now, if the pressure sore becomes more than just a slight little open area, it can get necrosis in there, where that area that you couldn't see inside the tissue, if the skin is open, now you can see it, and you'll see the what we call necrotic tissue. That's where that tissue has died, and it will slough off, and it will come out of where the skin is open. Sometimes the doctor will prescribe some ointments to help clean that up. Sometimes they'll prescribe some antibiotic ointment for it. If it's really a significant, like stage 3 or 4 ulcer, sometimes they'll prescribe a vacuum pump to seal up that area and help withdraw some of that fluid and tissue from that area. So there's all different kinds of treatments, but the one common thread through the whole thing is you have to stay off of it. So if you have to, be off of work or off from school, or, halt your life for a month or two to heal up that pressure ulcer without getting it open, that would be great, because that would be the first start. So there's all kinds of treatments that come and go about skin breakdown. There's a real popular one about using honey, but it's not honey like you put on your toast. It's a medication that's made of honey. And so sometimes people do that because there's a lot of sugar in it, and they say that feeds the wounds. Well, who knows? Some people swear by it. Some people are like, are you kidding me? Don't you dare. So you need to have a health professional look at that wound and prescribe exactly what kind of treatment. But whatever they prescribe, you have to stay off of it. Now, some people say, oh, but I have a cushion on my chair. Well, remember, cushions, first of all, you have to have one that disperses the pressure. So if you're sitting on a piece of foam, that makes the pressure worse because the foam collapses and consolidates. Now, there's medical grade foam that's different. That will disperse the tissue, the pressure, and so that helps. But there is no cushion, there's no bed surface, there is nothing that takes away pressure. So there's always pressure there no matter what when you're sitting or laying on that red spot. Some people will use different kinds of bed surfaces. Some people can even get medical grade beds where you're kind of floating on a cushion of air instead of the bed, but even still that's some pressure blowing on your area. So you always have to turn and keep pressure off, and if you have a red spot, you have to stay off of it. And so far, that's just the way that life is. and after the red spot is healed up, be sure and take a picture of it with your cell phone, or if you have a camera where you're not going to take the film to be developed, something that you can keep personal unto yourself, especially if the pressure area is in a personal spot like on the buttocks. So you can take a picture of that, and then you can keep track, because we can't really turn around and look at our own rear ends. We can look at it through mirrors, but sometimes you think, well, is it a little bigger than it was yesterday? Does it have a dark spot in it? I just quite don't remember. If you take a picture of it with your own personal cell phone, then you can kind of chronicle it along to see how it's going. Also, it's helpful that you be able to see how it's healing. So that's a real good thing. When the red spot goes away, or when it's finally time to sit on the area again, you're going to have to rebuild up your skin tolerance. So you can't go back to sitting 8 hours like you did before you had the pressure ulcer. You're going to have to start sitting for 5 or 10 minutes, and then getting off, checking to see if there's red. Okay, if I can tolerate 5 minutes, can I tolerate 10 minutes? And then getting off the area and checking it every 10 minutes. So, and you have to do your pressure releases religiously. You have to maintain a very healthy diet and drink your water, because you don't want anything that's going to take any nutrients away from that area. Smoking is number one, because nicotine binds to the red blood cells, so the red blood cells can't get to the area to heal it up. There are a lot of people, a lot of surgeons who will not do surgery on any part of your body if you're a smoker, with or without spinal cord injury, because it's that damaging to the wound healing process. So another important thing is not to smoke, vape, e-cigs, all that stuff. Be careful what you're inhaling and putting into your body. And then you have to build up your skin tolerance, and then there will be a scar there. And it could be the tissue inside your skin that could be scarred, so you religiously have to do your pressure releases. That is the only way to keep your skin intact. And, monitor, look for those red spots before they get out of control. Alcohol is another thing that can keep your body from healing well and keeping that wound from healing well. So the skin changes its texture and elasticity with alcohol. So if you're drinking alcohol frequently, that's another thing to think about giving up. So here, what are some ways to deal and help with edema? Kind of it's all fitting in with our skin theme today. So the first thing is to put the limb up higher than the heart. So when you're in bed at night, if you can prop your legs up, don't fold up a pillow and put it behind your knees, because that's an area where you can get blood clots. But if you have some foam, or if you can put like one pillow under the thigh and then 2 pillows under the calves, and be sure and protect your ankles so that you don't get foot drop with the foot hanging over the edge of the pillows. So you might want to wear some kind of boots, or sometimes people wear high-top tennis shoes in bed at night, because that will hold their feet up in position. The other thing that's the first thing. The other thing that you can do is to get some of those old Ted hose. Actually, don't use the old ones, because the elastic tends to decay over time. So get yourself measured. You can get some anti-embolytic, some of those elastic stockings. They come in all different colors now, so they're not that traditional white. Think about if you'll need them. If you have a lot of edema, you'll need them to go all the way up your thighs. If it's just kind of a little edema in your feet, you might be able to get away with the elastic hose that come up to the knee. But those are some of the things. The limb has to be higher than the heart, which can be difficult when you're sitting up to get your foot higher than your heart. You really can't sit that way. It also changes the pressure areas on your bottom where you're sitting. You can get a pressure ulcer right there at the end of your sacrum if you change your seating position that much. So it's more when you're laying down, can you put your feet up higher than your heart? Your hands if it's in your hands, you might be able to get those higher than your heart if you stack them up with pillows, and then that will help. Now, the part of your hand or your foot that's furthest away from your heart has to be higher than the rest of the limb. So if you stack up pillows and you put your arm up on top of the pillows and your fingers are hanging down along the edge of the pillow, all that edema is going to collect in your fingertips because it's hard for the body when you're not using the muscles of your legs or your arms. It's hard for that fluid to get pumped back up to the heart and eliminated by the kidneys. Now, say you have some really severe edema and you put your legs up, be sure and check your back, the small of your back in the morning when you get up, because sometimes when your legs are up like that, the same thing happens like if something's dangling over the edge of the pillow, is that the fluid will collect in the small of your back because that's the lowest point where the fluid can go. And that's where it's always going to want to go, is to the most dependent part. So when you're sitting, that's why your feet get so swollen before the rest of your legs do. So look at that and see if you're getting that edema in your back. If you're getting that kind of edema, if it's that severe, you'll certainly want to talk to your healthcare professional. Maybe they'll want to prescribe a diuretic, or maybe they'll do some other kinds of treatments. Maybe they'll get some of those, they're like wraps that you put on your legs at night or when you're in bed, and it's compression that helps move that fluid up. So maybe they'll want to get you something like that to help move that fluid along. You can wear them when you're in the chair too, but it's a little more difficult to get that all arranged. But that's the way. Start out with the easiest, and you know, if the edema is really severe, you'll want to talk to your healthcare professional. You can take your finger and press it against your shin bone, maybe just like an inch or two above your feet, and if the skin stays indented and doesn't pop back, you've got edema. So that's a good way to tell. You can also tell if you're dehydrated, which is exactly the opposite. If you just take the loose skin on the back of your hand, and if you just very gently pull it up, if it stays up like a little tent, that means that you're dehydrated and you need some more fluid. So that's kind of the opposite, but you can check edema in your hand if you use your finger and press on the back of your hand, and if a dent forms, you can see that you have edema there in your hand. So that's kind of like going from the easiest treatment up to the most comprehensive and most strictest treatment. What do you do after you've been on gabapentin for 5 years? It's not touching my neural pain anymore, paraplegic from back surgery, and I'm also a hemophiliac. So this happens with nerve pain medications. The gabapentin and the pregabalin, which is Neurontin and Lyrica, are two medications that are formulated for nerve pain. Other medications that you can take are some anti-epileptic medications, but in real small doses. They won't treat seizures, but real small doses. And some of the antidepressants taken in real small doses have been noted to treat these pains. But what happens is neuropathic pain, it's an odd little prankster, and you can be on something, it's working just great, and then one day it's like, wow, this just isn't holding me anymore. And again, it comes on over time. And so you probably notice this. So 5 years, that's if you've just been on the same dose for 5 years, that's pretty great. Sometimes people get adjusted to their neuropathic pain medication, and what happens is that they need to up the dose a little bit, and they'll find that that works out. Sometimes one pain medication stops working, and so you have to go off that pain medication. So if you've been on the gabapentin, maybe you want to try going off that and going on the pregabalin. Maybe one of the other medications with from the anti-epileptics or antidepressants, sometimes those will work better. Neuropathic pain does not stay stagnant. It loves to change and become something different, and it loves to be able to accommodate one pain medication, and then it'll, act up again and so you have to change dosage or change medication. Now, the weird thing about neuropathic pain is that after a while, sometimes it just goes away too. So don't think that it's like, oh my gosh, I could be fighting this forever. You might be fighting it forever, but sometimes it just goes away. Sometimes people go off their pain medication and they're like, well, I don't have any pain. I don't know when it went away, but it's gone. So it works kind of in both ways. It can get much worse, and then it can get much better. So, talk to your healthcare professional. Maybe if you haven't gone up on the dose, they'll probably, shoot it up just a little tiny bit more, and you'll have to become adjusted to that that increase in the pain medication. And so you might be tired for a while, or you might have some complications for a while, because those medications sometimes can have complications for like 8 days. And then on the 9th day you wake up and it's like all the side effects are gone. So it's a weird, neuropathic pain is a weird problem, and the treatment has to be as kind of unusual as the problem. So here's another question that's also a very good one, and it's about a person who is C3 Asia D for 6 years, and all of a sudden this person's getting muscle spasms. And so the question is, how and why do they occur, and what's their impact, positive and negative? Actually, with muscle spasms, if it's just a little bit of spasm and it's not bothering you, they can be very, very beneficial, because as the spasm occurs, sometimes people will get a tone that's kind of almost has a beat to it. And so if that's not bothering you, and it's just as a little bit of your leg bouncing a little bit, that can actually help, because every time your leg's bouncing, it's doing a little bit of a pressure release. Those muscles contracting are moving around. So, it can be, spasms, shockingly, can be a good thing. When they become painful, or when they're so severe that they're throwing you out of the wheelchair, or maybe that bounce you find just intolerable because it's just bugging you for whatever reason. So some things that you can do, again, starting from the most mildest treatment to the very deepest treatment. One thing that's very helpful that people overlook all the time is to do some range of motion with the muscle spasms. So that's a very good thing to do, because it fatigues the muscle, and if the muscle's tired, it can't spasm because it needs to rest before it can start up again. So some people will do some range of motion, some activity. At Asia D, you might be able to get up and walk around a bit, and that might help release the spasms. It's that activity tires out the muscle. Following that, you might want to try more heavy activity. If you have access to any kind of training equipment, or if you at Asia D, you might be able to use some resistance. You might be able to use some resistance bands, which you've probably seen in the therapy department. They're like big, gigantic rubber bands that you can hold with your hands and then stretch your leg out a little bit, and that helps. Even if you don't have movement in your leg, you can use resistance bands to help pull the leg up to do the exercises, so that's a good thing. And then there's also medication that can help the spasms. There's oral medications which will relax not only the muscles that are spasming, but all the muscles in your body. So a lot of people don't like to take those because they become very tired on those. Very popular now is to get the Botox injection. If it's one muscle that's spasming, you can get a Botox injection there. It'll calm that muscle. You will have to take repeat injections because Botox wears off over time. So that can help if you just have some muscle spasms in isolated areas that can be treated, and then you don't have the side effects of the oral medications. Now at Asia D, you might not want to take the Botox injection because you might lose some of your function. So that would be plus minus to think about, a risk and benefit. Why are they happening now? Well, you've been 6 years. Probably that is the culprit. So as we age, yikes, our bodies tend to not act as they did when we were younger. And so it could be that maybe the spasms are starting now because maybe you haven't walked as much as you did before, because sometimes it's just difficult to do. It's so much easier to get around in a chair, is what people tell me. But then also sometimes as we age, what's happening a lot with people who've had polio in their younger age now are older, and we're kind of seeing this bounce back in polio. It's not the polio virus that's active again, but it's a post-polio syndrome where people's muscles aren't as strong as they were as when they were younger. And so what they were able to compensate with now is not as strong as it used to be. It'd be a good idea for you to talk to your physician and see if a little round of physical therapy, most people have 2 weeks of physical therapy in their health insurance policy. And maybe you could take that time to talk about a little tune-up for yourself to see if there's some muscle strengthening exercises that you could do at Asia D to get you back where you were and help control these spasms. But that's kind of the progression of how spasms are treated, with starting with the smallest and then working up. Aquatic therapy, again, would be, I'm not pushing that today, but it seems to be quite the answer to a lot of issues. That can help you because you can use some of that resistance in the water to help build up your abilities. At C3, maybe you don't want to go in the water. You should certainly have somebody with you, and maybe go with a therapist the first couple of times so you know what you're doing. And then maybe that might be something, but talk to your healthcare professional to make sure that that's right for you and not contradicted with any other issues that you may have. So with that, we're at the top of the hour. So I would like to thank everybody for coming today. It's always fun spending time with you, and I hope to see you in the community. I'll be in there tonight if anybody has any further questions. So just be sure and just write in, and we'll talk privately or however you'd like to handle the issue. So thank you very much for logging in today.
This concludes today's call. Thank you for your participation. You may now disconnect.